In this morning's health check, it is that dreaded time of year, mosquito season. Say it ain't so. So how can you defend yourself against the pesky insects while also protecting your skin, of course? Here with more is board-certified dermatologist Dr. Sherry Ingraham. Thank you so much for joining us once again.
Thank you.
Sherry, I feel like if we don't talk about it, maybe they won't come.
Wouldn't that be wonderful?
That'd be great, but that's not true.
Not going to happen.
So let's talk about it. We do want to protect ourselves from mosquitoes, but also it's important to make sure our skin is protected as well.
Yes, you have to protect your skin, especially your extremities, because we know mosquitoes are attracted to cooler parts of the body. So our core is the warmest, which is why we're usually bitten on our arms and legs. And it's hard to wear long sleeves in the summertime or even the spring in Houston, so you really need to invest in some good insect repellents.
And let's talk a little bit more about that. We talked off camera about some of the things we should do. Lighter colored clothes.
Right, so the brighter the clothes, the lighter colored the clothes, insects aren't attracted to them. They're actually attracted to dark objects and foliage, so darker clothes attract mosquitoes.
And you talked about the areas of our bodies that are more prone to these pesky mosquitoes.
Yeah, the areas you're uncovered when you're outside, they're actually attracted to arms and legs, actually movement. So people who are moving are putting off more carbon dioxide. Larger people are putting off more carbon dioxide. So actually if you're laying somewhere, you're going to be bitten less.
And resist the itch. Please explain that.
It's hard to do, but the more you scratch, the more histamine you release. And histamine is that chemical in our bodies that causes inflammation and swelling and more itch. So if you can avoid itching, it's ideal. Some of us can't. So getting an over-the-counter steroid like Cordaid and putting it on there can help a great deal. Also, sometimes taking an oral antihistamine like Zyrtec or Benadryl if you have a lot of bites, or in children who have a lot of bites, can help. You want to avoid topical Benadryl, the anti-itch Benadryl. That's a cream or a gel, because that can actually cause a sensitization over time.
And then let's talk about some of those sprays.
Right.
Are they good for the skin? I mean, they have the, help me, the
DEET,
the DEET,
the
right?
off. So what we know now is in the concentrations that are available on the market, DEET is safe. In children that are over 6 months of age up to the age of 12 years, you want to stay in the DEET 10% or less range, which are off products.
Okay.
They also make some stronger DEETs. Those are perfectly safe. You just want to wash them off at bedtime. You don't want to keep them on the skin or keep reapplying them throughout the day. Some of the newer products like picaridin, which is Cutter Advanced, which is another chemical that's been around since 2005, is safe and effective. Again, safe on children 6 months of age and older. And now there's some herbal products that are hitting the market. These are particularly unique because people perceive them to be safer. They may be, in long-term studies, safer as far as absorption is concerned, but they're not as effective. And so you have to kind of weigh, do you want to get bitten and possibly get a arboreal or mosquito-borne virus, or do you want to get less bites?
Right.
And so I think it's more important to get less bites. And so they found the CDC actually endorses a product called Repel, that is the oil of lemon eucalyptus that's as strong as about a 10% DEET. So that's a good product to look for.
Wow, a lot of information, good information too, especially when we're talking about these mosquitoes. Thank you so much for joining us and helping us protect ourselves and also our skin.